Hello, Miss O'Neill. My name is Natalie and I'm going to be your student nurse today. Today we're just going to be doing a quick head-to-toe assessment to assess your body's overall functions and to identify any abnormalities. This exam might require some position changes as well as me asking some personal questions. Is that okay with you?
Yes.
Okay. And then do you need to go to the bathroom before we begin?
No, ma'am.
Okay. So if you're ready, we can go ahead and start.
Okay.
And so we're going to go ahead and start with our client's overall appearance. Our client is well groomed. She doesn't display any signs of dishevelment. So I'm going to go ahead and move on to orientation. So I'll ask you, what is your name?
Elizabeth O'Neill.
Okay, and what is your date of birth?
11/3 of 1990.
Okay, and then do you know where you are?
My house.
Okay. And then do you know what day it is?
Today is November 8th, 2021.
Okay, and then who is the president?
Joe Biden.
Okay, so now we know that our patient is oriented to person, place, time, and situation. All of her thoughts and speech are appropriate for her age, and she does not show any signs of developmental delays. So next we're going to assess the skin, and just by looking at her skin, we can tell that it is even in skin, color, and texture. There are no breaks in the skin. There are no abnormal lesions or nevi. The temperature is warm, but it's not hot. There's no excessive moisture. And real quickly, I'm just going to go ahead and, can I see your hand? I'm going to assess for skin turgor. And so we can see that the patient has good skin turgor, which means that she's not dehydrated and there's no loss of fluids as well. Could I see your hands again? And I'm just going to assess for capillary refill. Okay, and capillary return is less than 3 seconds, which indicates adequate perfusion. Next, we're going to be moving on to the head, and just by looking at the head, we can see that her hair is evenly distributed. There's no early signs of thinning. I'm going to go ahead and palpate her scalp, and I don't feel any abnormal lesions or lumps or bumps. Her head is normocephalic and is appropriate in size and shape for her age. Let's see what else. Next, we're going to be examining her facial nerve, and that is cranial nerve 7. And so we'll be doing this by asking you to go ahead and demonstrate some facial expressions. So could you go ahead and smile for me? Okay. And could you frown? Okay. And can you puff out your cheeks? Good. Can you show your teeth and raise your eyebrows? And then can you squint your eyes really tight? Okay. And so now we can see that all of the movements were bilaterally equal. And we can say that cranial nerve 7 is intact. Next, I'm going to be assessing the cranial nerve 5, which is also the trigeminal nerve. And I will be doing this by doing a series of sensations, and I just want you to let me know whether or not the sensations are dull or sharp, okay? So could I have you close your eyes?
Sharp. Okay. Dull. Sharp. Dull.
Okay, so now we can say that the sensory part of cranial nerve 5 is intact. And next I will be assessing the motor function of cranial nerve 5. And I'll do this by having you clench when I say go. Okay, open. And go. Okay. And open. And clench. Great. Okay, so now we can say that the motor function of cranial nerve 5 is also intact. Next we'll be moving to the eyes. And could I have you remove your glasses? Yes, and so we can see that the eyes are bilaterally equal in position and shape, and there are no redness, no swelling, and so I'm going to go ahead and palpate the lacrimal apparatus, and can you let me know if you feel any tenderness? No. Okay, so patient reports no tenderness, there's no signs of swelling. Could I have you look up? I'm just going to examine your bulbar conjunctiva. Okay, and so there's no signs of pallor. The sclera is moist and white. Next, I'll be testing the patient's visual acuity using the Snellen chart, and the patient does have 20/20 vision in both eyes, which tested cranial nerve 2, which is the optic nerve. So next I'll be moving on and I will test direct pupillary response. And so I'll do this by shining the light into one eye and checking to see if it constricts. So could I have you look? And her eye did constrict. Okay, great. And so now I'll test consensual response, and I will make sure that both pupils constrict. Okay. And so we know she had good consensual response because both eyes constricted. Next, I'll be testing for convergence. So I just want you to follow my pen light really quick. Okay, so both eyes constricted and she had good convergence. Next, I'll be testing the 6 cardinal fields of gaze, and I'll be doing this with my pen light. And this will test cranial nerves 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens. So I'll just do this by having you follow my pen light. Okay, and so the patient did not show any involuntary shakiness of the eyes, which means that there's no nystagmus present. Otherwise, the eye looks great. We will also move on to the ears now. And so you can go ahead and put your glasses back on. Just by looking at the ears, there's no signs of redness, no inflammation, no cerumen impaction, and I'm just going to quickly check the other ear as well. Okay, so next we're going to be testing cranial nerve 8, which is the acoustic nerve, and we'll do this. We'll use 3 tests. We'll use the Weber test, the Rhine test, and the Whisper test. So first I'm going to start off with the Weber test. And by the way, I did note that there's no discharge present in either ear. So starting off with the Weber test, I'm going to strike the tuning fork, and I need you to let me know whether you hear the sound in both or one ear, okay? In one or both ears, okay? So the patient reports both ears, which is good because if she only heard it in one ear, that's an indicator of conductive hearing loss. So next we'll go ahead and do the Rhine test, and I'm going to strike the tuning fork and place it on the mastoid process, and I want you to let me know when you stop hearing it, and then I'll strike the tuning fork again and I'll change positions, and I want you to let me know when you stop hearing that sound as well, okay?
Okay. Stop.
Okay. And so it's important that you look at your watch whenever you're performing the Rhine test, because the patient should always hear air conduction twice as long as bone conduction. So next we'll do the Whisper test. And so what I'm going to have you do, I'm going to have you face with your back towards me. Okay. And so I'm going to whisper a word to you, and I need you to repeat it. Okay. So can I have you cover one ear? Okay. So I'm going to whisper a word, and you need to repeat it. Okay. Apple. Okay. And so can I have you cover your other ear?
Banana.
Okay. So that was good. Next we'll be moving on to the nose. Judging by the nose is midline. It is not red or inflamed. There's no discharge coming from the nose. Both nares are symmetrical. Could I check for patency of the nose?
Sure.
So what I'm going to have you do is I'm going to have you close one nostril and breathe in. So cover one nostril and breathe in. Okay. And can I have you do the other one? Okay, great. I'm also going to palpate the external nose for any signs of tenderness. Is it tender? No. Okay. And so next what I'm going to have you do is I'm going to check for the cranial nerve 1, which is also the olfactory nerve. And I'm going to have you do this by closing your eyes and taking a whiff of a smell, and I want you to identify that smell, okay? So could you go ahead and close your eyes? And I'll let you know when to sniff. Okay, and sniff.
Vanilla.
Okay, great. And it is in fact vanilla, so she did pass that test. And so the nose is good. Next, could I actually have you remove your glasses again? Okay, so I'm going to go ahead and palpate the sinuses. And so let me know if you feel any tenderness. Do you feel any tenderness there? Okay. And so there's no signs of swelling or inflammation or edema within the maxillary sinuses. Next, I'm going to go ahead and palpate the frontal sinuses, and I want you to let me know if you feel any tenderness as well. Okay. So next, we'll be moving on to the mouth. And I'm going to go ahead and take a quick look inside of your mouth. Okay. Can you say ah? Okay. And so the oral mucosa was pink, it was moist, all teeth were present. Whenever she said ah, we tested cranial nerve 10, which is the vagus nerve, and it was actually intact due to the way the uvula moved midline. Could I have you stick out your tongue? A little bit further, okay? So the tongue is midline, it is pink, and it is moist, and I'm going to check for cranial nerve 12. And so what I'm going to have you do is push against resistance against my tongue blade. So lift up. Okay, great job. Okay, and so now I'm going to assess for cranial nerves 9 and 10 by having the patient swallow. Okay, good job. And so now after that we'll be moving down to the neck. So the throat is midline, it is not inflamed, it looks like it is bilaterally symmetrical. I'm just going to go ahead and quickly palpate for the trachea. And the trachea is midline. Again, it's not swollen. So I will also go ahead and palpate all of your lymph nodes. So starting back here is the occipital lymph nodes, and I don't feel any enlargement. We're going to move to the preauricular right here in front of the ear, the postauricular, the submandibular, the submental, and then the supraclavicular, as well as the tonsillary, the anterior cervical chain, and the posterior cervical chain. And so I did not note any enlargement of any lymph nodes. Next, I'm going to be auscultating for any signs of a tracheal bruit, as well as a carotid bruit. So. Okay, and so no bruise heard. And next I'm going to be palpating for a carotid thrill. And her carotid pulse is regular and palpable. So I would grade that as a 2. Next, I will be checking cranial nerve 11 by having you shrug your shoulders against my resistance. So go ahead. Okay, great. And then now we'll be moving on to the arms. Looking at the arms, they're symmetric in size and shape. There's no lesions, no masses, no edema present. Her bony prominences are good, they're clean, dry, intact. Okay, could I have you go ahead and hold on my fingers and pull them as hard as you can? Okay, so grips are bilaterally equal and strong. Next, I'm going to be checking your reflexes. So, could I see your arm and just kind of hold it out like this. Okay, so now we'll be checking the biceps reflex. Okay, and now can I have you dangle your arm like this? And I'll check the triceps. Okay, and now can I have you dangle your arm like this, and we'll check the brachioradialis. Okay, great. And so next we'll be moving on to the posterior thorax. So could I have you turn to your back? Okay. And so anytime I say 90, or anytime I move my hands, I want you to say 99, okay? And we're just going to be checking for affirmatus, so go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Okay. Next, I'm going to be listening to your breath sounds. So could you turn back again for me? And I want you to take a deep breath in. Okay. Out. In. Out. In. Out. In. Out. In. Out. Okay. And so your breath sounds were all normal. There were no adventitious breath sounds, no stridor, no crackles, no wheezes, no rhonchi. Her posterior thorax is normal. There is no lesions, no lumps or bumps. Next, I'll be checking the anterior thorax. And so I'm going to do the same thing. Anytime I move my hands, will you say 99?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so that's good. Her affirmatus was audible and clear. Next, we're going to be checking breath sounds. Again. Okay. And so no adventitious sounds heard there. No stridor, no crackles, no wheezing, no rhonchi. And so from there, and can I have you face your back towards me? I will do this. I need a test for chest wall expansion. So what I'm going to do is I'm going to have you take a deep breath in. Okay, now exhale. Okay. And so both of my thumbs did move outwardly equal, which indicates good chest wall expansion. And next, I'm going to be assessing your abdomen. So could I have you lay down? And while you're in this 45-degree angle, I'm going to go ahead and check for jugular vein distension. So could I have you turn? Okay. And so she does not have any jugular venous distension noted right here. I forgot also, could I have you sit back up? And I'm going to listen to your heart sounds. So starting with the aortic, pulmonic, Erb's point, mitral, and tricuspid. Okay, great. And so now we're gonna go ahead and look at your abdomen. And so could I have you lie down? Great. And so looking at her abdomen, her skin is uniform in color and texture. Her contour is flat, there is no distension. She has no abnormal masses or lumps. So I'm gonna go ahead and auscultate the abdomen, starting with the right lower quadrant. Okay, and so bowel sounds were heard in all 4 quadrants, which indicates good peristalsis movement. Next, I'm going to go ahead and percuss over the same 4 quadrants. And just let me know if you feel any tenderness. Okay, and so tympany was heard in all 4 quadrants. Next, I'm going to be doing some light palpation. And so I want you to tell me if you feel any tenderness at all. And I'm just checking for any abdominal guarding or muscle reflex. Okay. And so there was no abdominal guarding, which if there was, it would be a sign of potential hernia or aortic aneurysm. Next, I will be inspecting the legs, and just by looking at the legs, they're both symmetrical in size and shape. The length are symmetrical to each other. The color is uniform in color. She has adequate hair distribution that's even. There's no breaks in the skin. Let's see. Her toes are good. They're not swollen. So now I'm going to test for capillary refill in the toes. And she does have capillary return less than 3 seconds, which indicates good perfusion to the lower extremities. Next, I'm going to palpate the dorsalis pedis muscle, pulse. And that pulse is strong and regular. Next, I'm going to be assessing the anterior tibial, right here. And that pulse is also strong and regular. And so next, we're going to be testing the pedal push. And so could I have you push against my resistance in my hands? And so I'm going to have you push. Okay, great. And then I'm going to come back over here and I'm going to have you do the same thing. Okay, and now push. Right? And so dorsiflexion and flexion of the feet were both bilaterally strong and equal. Let's see, so could I go ahead and check your reflexes? Okay, and so first, yes, I'm going to have you dangle your feet, and I'm going to check your patellar reflex, okay? Great, and so her leg did jerk. Next, I'm going to be testing the Achilles reflex right here. Great, okay, thank you. And now, could I have you stand up? Okay, and so I'm going to have you close your eyes and stand in a T position. Okay, and so this is called the Romberg test, and there's no swaying noted, so she had a negative Romberg test, which is good. Her balance is steady. The next test I'm going to have you to do is I'm going to have you to turn, and I'm going to have you to do a heel to toe walk to the edge of that couch and then walk back to me, please. Okay, and so her gait is steady and even, and she shows no signs of struggling. So other than that, that concludes our exam, and I thank you so much for being my patient today.
Thank you.
Thank you. Okay, and I hope you have a nice day. Thank you.